Dr. Richard Lai here with Study Acupuncture with me. This video is on Shang Han Lun. I hope it helps you study for the Acupuncture Board exam. Before we get into the video, just want to say happy Thanksgiving to everyone. Thank you guys for supporting the channel. If you liked the video today, please hit the like button and make sure you subscribe so you don't miss any of the videos coming up. And I know a lot of you are getting together for the holiday season, so make sure that you're nice and warm, your neck is covered, and you have your mask on. So now let's get into the video.
Hey everyone, so this begins the multi-part series on the Shang Han Lun. I will go over the patterns according to the 6 stages, and I'll explain the pathology as well as the reasoning behind the point prescriptions. I'll throw in some analogies as well that I hope you find helpful as you're studying for the Acupuncture Board exam. So let's get into the Shang Han Lun. So the Shang Han Lun is one of those groundbreaking books. It was written in the late 100s or early 200s. And I'm going to say that year again, in the early 100s to 200s. Right now, it's 2020, 2020. And the Shang Han Lun was compiled in the year 200, around the year 200, basically super close to the year zero. It's actually kind of humbling when you think about it. So it was written by Zhang Zongjing, who is a Chinese doctor of that time. And why was this text groundbreaking? Well, first, it was based on years and years of clinical cases, right, that Chinese doctors and practitioners during that time compiled. And it was actually the first time where all of this knowledge was put from ink to paper. And it was a compilation of all the pathologies, aka the causes of diseases, and to interventions, aka the treatments of diseases that were from an invasion, an actual invasion of an exterior pathogenic factor. And number two, why it was so groundbreaking was the herbal formulas. They were compiled and they are actually even being used to this day. So the Shang Han Lun really just changed the paradigm of diseases for, centuries. In other words, the Shang Han Lun broke the internet during that time. And what became really popular was this idea of when cold as the primary cause for disease. So when cold was the primary cause for, a lot of the diseases in many cases. So like today, what do we say is a cause for disease that everybody has? Everybody has spleen qi deficiency today, and everybody has liver qi stagnation today. And then later on, after Shang Han Lun kind of lost its steam, I'm just kidding, but there was another paradigm shift that brought wind heat to the front, and that's where we get the wind bing from, and that's where we get 4 levels from. But you'll see, even as we go over the 6 stages, there is some wind heat there, but you'll see wind cold really prevails. So the thinking at that time when Shang Han Lun was basically like the Instagram book with the most likes was that wind cold symptoms would basically turn into or transform into heat. So that's why the Shang Han Lun is called the Discussion of Cold-Induced Diseases by Zhang Zongjing. So Shang, like sang, actually in Chinese is injury. Han is like cold, right? Like an internal cold that you get injured by. And then Lun means like a theory or like a viewpoint. So that's sort of just a introduction into the Shang Han Lun and the history as to where it came from. So let's get into the nitty gritty of the 6 stages. So first, this graphic seems really scary, okay? And it's not meant to scare you. When we study things, right? Whenever we start studying, it can be very hard, right? But we have to realize that whenever we do something new, whenever we learn something new, it's always hard, right? When you first learned to ride a bike, you fell lots of times. When you first started to learn a new language, it's hard. Trust me, I know. I had to go to ESL in grammar school. And for those of you that don't know, ESL is English as a second language. And keep in mind, I was born here in the United States. I just have parents who don't speak English that well. So all of that is hard in the beginning, and we accept it and we trust that it will get easier. It gets easier only though with practice. So let's look at an eagle's eye view of the 6 stages. You've seen some sort of version of this, right? And it's not so bad. This is all there is to the 6 stages. Let's start on the left side. On the left side, you have the 6 stages. From the top, you have the greater yang stage, which is also known as Taiyang. This is the very beginning. This is the very beginning stage. And this is also the only exterior stage, right? We're talking about an invasion of a disease. The disease comes in, it invades our body, and it goes through these different levels or stages of penetration. And as it penetrates our body, symptoms start to transform, right? And in this case, they transform to more heat. So now, before we go any further, the best way to look at the stages is to look at it from two different frames of reference. We want to look at it from a channel frame of reference, and we want to look at it from an organ frame of reference. So, do you remember the Chinese clock? And do you remember the meridian theory? Right, that's where qi flows through all of your meridians, and that qi focuses itself in certain organs, right, at different times of the day. So, for example, we have Taiyang. Taiyang has two organs in it. And what are those two organs? Those two organs are the small intestine and the urinary bladder. Now, what times correlate to the small intestine and the urinary bladder? So we have small intestine being 1 o'clock to 3 o'clock, and then urinary bladder being 3 o'clock to 5 o'clock, both of those being PM. Now, where are those channels? Those channels, small intestine starts in your hand, right? And it goes up to the back of your shoulder, goes up to your neck, right? And then urinary bladder starts in your foot. It goes up to the back of your leg, it goes up your back, and it goes to your neck, goes up over your head, and then it goes right to your eye. So, what's common between those two things? What's the commonality there? They both travel over the neck. They both travel over that upper back area. So, what about the next stage? So the next stage we have Yang Ming or bright yang. And what are the organs included in bright yang or Yang Ming stage? We have large intestine and we have stomach. And what are the times for large intestine and stomach? We have 5 a.m. to 7 a.m. for large intestine, and then we have stomach, which is 7 a.m. to 9 a.m. And where do the channels go for the large intestine and stomach? The large intestine channel goes from your hand, it goes up the side of your arm, it goes to your shoulder, it goes across your neck, right? It goes up to your mouth, and then it goes to your nose. The stomach goes from your eye, it goes down all the way down to your foot. So it crosses your neck, goes across your chest, your stomach, right, the front of your leg, and then it goes down to your foot. And then we have this Xiao Yang, right? Xiao Yang is also known as the lesser Yang. And it's made up of the Sanjiao, and it's made up also of the gallbladder. So Sanjiao is 9 o'clock to 11 p.m., and gallbladder is 11 p.m. to 1 a.m. And just as a sidebar, look at that there's this 11 p.m. to 1 a.m. crossing shift, right? There's like this cross from a p.m. to a.m. shift there. Just like a side note. So Sanjiao starts at your hand, right? Goes up, back of your forearm, goes to your shoulder, goes across your shoulder, up the back of your neck, goes behind your ear, right? And it ends near the eye. And then gallbladder, similar, it starts near your ear, crosses behind your ear, crisscrosses back and forth, back and forth, back and forth, right? Goes along the side of your head, goes down your shoulder, side of your rib cage, goes down to your butt. And then it goes down the side of your leg, your IT band, goes around your knee, goes around those collateral ligaments, goes to your fibular head, your peroneal muscles, and then it ends in your foot. So there's a lot of crisscrossing back and forth for the gallbladder. Anyway, I think you're getting the picture. So let's go through the next ones. We have greater yin, also known as Tai yin. You got the lung, You've got spleen. Lung is 3 a.m. to 5 a.m., and spleen is 9 a.m. to 11 a.m. And next we have Xiaoyan, which is lesser yin. And in Xiaoyan, there's two organs. There's the heart and the kidneys. The patterns in Xiaoyan are cold transformation and heat transformation. And the fact that there's heart and kidneys, it makes that much more sense because cold transformation is actually kidney yang deficiency. Heat transformation is kidney yin deficiency. And then last but not least, we have the terminal yin, the very end, the jui yin, which according to the sixth meridian theory is made up of the pericardium and the liver. Pericardium, according to the Chinese clock, is 7 p.m. to 9 p.m., and the liver is 1 a.m. to 3 a.m. All right, so now that we went through all of that, let's get into each of the stages. And the first stage is the Taiyang Stage. So the Taiyang Stage is the beginning stage. It's the only exterior stage. And just to recap, right, we have the sixth meridian theory. There's 3 yang, there's 3 yin. There's Taiyang, Yangming, Xiaoyang. Then we have Taiyin, Xiaoyin, and Jueyin. This is also known as the 6 stages. And each of the stages have organ pairings that we just went over. So Taiyang, for example, is small intestine and urinary bladder. That's its pair. And according to the Chinese clock, small intestine is 1 to 3 p.m. and urinary bladder is most active from 3 to 5 p.m. And so for this stage, it makes sense to understand the channel pathway. The small intestine, right, goes from the back of your hand, goes up the back of your shoulder, goes to that neck area, right? And then urinary bladder starts in your foot, goes up the back of your leg, goes up your back, right? Goes up your neck, goes over your head, and it ends in your eye. So we see clearly there's an overlap, right? There's an overlap of the neck, there's an overlap of the upper back area. And you can see that in the picture as well. So they both travel over the neck and the upper back area. So with that in mind, the Taiyang stage is the first stage. It's the most exterior stage. And the Shang Han Lun talks about diseases whose cause is from wind, and in particular, wind cold. So this exterior pathogen of wind will invade the body, but it only invades the first stage, which is Taiyang. And this wind has a tendency to invade the neck and the upper back. So this relates why the Taiyang is the first stage of invasion, because of that commonality, because of that overlap of small intestine channels and urinary bladder channels as well. And this is also why in this stage, you'll see 3 very specific symptoms. Number 1, you'll see an aversion to cold and wind. Number 2, you'll see an occipital headache and a stiff neck. And number 3, because of that invasion of wind, when you palpate their pulse, they're going to have a floating pulse. So with those 3 in mind, let's talk about the channel patterns first. So channel patterns. Whenever you see a patient, whenever you evaluate a patient, every single patient that sits before you, you're going to perform in one way or another some form of differential diagnosis. And you're going to examine them via the 4 pillars. And from there, you're going to be brought through a couple different possible patterns. And how you confirm the correct pattern is through differential diagnosis. And in Taiyang, you have 2 channel patterns to differentiate from. You have attack of wind and you have attack of cold. Now, they both have the same pathology, right? Which is an invasion of wind cold. The only differentiating factor between the 2 is that one has more wind, or a prevalence of wind, depending on what textbook you read. And the other one, there's more cold, or a prevalence of cold. But what does that look like in your patient, right? That's what we care about. What are the symptoms in your patient? So with wind attack, you have these manifestations, and read it out loud with me. So we have slight aversion to cold. We have aversion to wind. We have slight fever. Here we have slight sweating in wind attack. We have a headache, stiff neck, sneezing, and we have a floating, slow pulse. In cold attack, we have aversion to cold. We have slight fever. We have no sweating in cold attack. We have headache, stiff neck, sneezing, runny nose, some white discharge, breathlessness, and we have a floating tight pulse. So we have overlap, right? We have overlap in the slight sweating. In that wind attack, there's slight sweating. In cold attack, there's no sweating. We have floating pulse. We have aversion to cold, and we have that headache, right? So the difference is in the sweating. Wind attack has sweating. Look at cold attack. No sweating in cold attack. This is because of the effect of wind, right? That pathogenic factor. The effect that wind has on your nutritive qi or your yin qi. And also the effect that that wind has on your wei qi or your defensive qi. Yin qi is nutritive qi. It nourishes your organs, it nourishes your entire body. It flows in your blood, it flows in your channels. And when you compare wei qi and yin qi, wei qi is lighter, it's more yang than yin qi. Wei qi circulates more in the exterior and yin qi circulates more in the interior. So when cold gets into the exterior, it messes up that circulation of wei qi, right? We talked about this in the lung 7 video. The lung diffuses, aka it spreads defensive qi and body fluids all over the body, especially to the space between the skin and the muscles. That space is called the Tso Li. So in the Tso Li, wei qi and body fluids flow together. And if there's an attack of wind cold, that's going to mess up the circulation and flow there. And then what's going to happen? The wind, the cold will cause the pores to be blocked, right, to a certain degree. And there's either going to be slight sweating or no sweating at all. So with that being said, with attack of wind, there's going to be some slight sweating. And with attack of cold, there's going to be no sweating at all. And what else do we see here? We see the pulses, right? We have a floating slow pulse and a floating tight pulse. So with wind attack, there's a floating slow pulse. And with cold attack, there's a floating tight pulse. So a quick peek into your pulse notes will show you that a slow pulse means a cold pattern. And a tight pulse means a cold pattern as well. So floating and tight means exterior cold. And a tight pulse that's full and deep means interior full cold. So now where do these symptoms come from? And to fully understand that, let's remind ourselves one of the functions of the lung organ. So we have the lungs that controls the space between the skin and the muscles, also known as the Tso Li. And we have here the fact that the lungs diffuse qi and body fluids to the Tso Li, and it regulates sweating. So it diffuses qi and fluids to the space between the skin and muscles. It regulates sweating. It provides resistance to pathogenic factors. Now, if wind invades this exterior space, it's going to mess things up. It's going to obstruct that space. And that obstruction of the wei qi, this is going to mess up the diffusing function of the lung. It's not going to diffuse qi and fluids appropriately. So you're going to get aversion to cold. And since lungs also diffuse lung qi to the nose, your patient's going to be sneezing, coughing, runny nose. So this invasion of an exterior pathogen to the Tso Li, what will happen is that the wei qi and the yin qi will become obstructed. Their flow will be messed up. And even further, there's actually even going to be an imbalance between the yin qi and the wei qi in wind attack. See, they're still going to both be there. It's just in relation to each other, there's going to be less yin qi than there is wei qi because of the wind. See, this causes that sweating in wind attack. We have the lungs that control the skin in the space between the Tso Li. We have the fact that the lungs diffuse qi and fluids to the Tso Li and it regulates sweating. So with this invasion of wind, its obstruction of the Tso Li, it causes that impairment to the function of the lungs. It causes impairment to the yin qi and the wei qi, specifically the yin qi being deficient. right? Because the yin chi's purpose is to nourish. Like when you bleed profusely or you sweat profusely, you're actually letting out some of that yin chi, some of that nourishment. So in this case, with the wind being more prevalent, there's still going to be some sweat. On the other hand, cold attack, there's a prevalence of cold. So both patterns have wind cold, right? With wind cold attack pattern, there's just more cold. So cold contracts things, it tightens things up, it'll tighten the pores up. So there's going to be no sweating there. So we covered the pathogenesis of these manifestations. So now we should go over how do we treat them? We treat them through treatment principles. So we have wind attack on the left, and then we have cold attack on the right. So in wind attack, we have release the exterior, expel wind and cold, restore the diffusing of lung qi. In cold attack, we also have those three. In wind attack, we have one addition, which is harmonize nutritive and defensive qi, aka the wei qi and the yin qi. So obviously in wind attack, we have to release the exterior, right? The pathogen is in the exterior. We also want to, number 2, expel wind and cold. That's an obvious one also. Number 3, restore the diffusing of lung qi. We talked about the obstruction already, space between the skin and the muscles, and how that obstruction impairs the lungs' diffusing function. So that's why the lungs then can't properly diffuse that qi and body fluids, right? So qi is supposed to warm you, right? In this case, you're going to have that wind attack. You're going to have aversion to cold. Qi is supposed to diffuse also to your lungs, to your nose. It's not doing that properly, so your patient's going to sneeze. And number 4, in wind attack, we have harmonized the nutritive and defensive qi. So there's that imbalance, like we saw in the graph before, right? There's a relative imbalance between wei qi and yin qi, also known as defensive qi and nutritive qi. There's going to be more wei qi in relation to yin qi, partly because of the sweating, but also because of that obstruction of qi, right? And the impairment of the lungs to even diffuse that qi and body fluids. So we want to harmonize that. So with cold attack, there's still those 3, right? We want to release the exterior. We want to expel the wind and cold. We have that obstruction to the space between the skin and the muscles. That obstruction impairs the lungs, impairs that diffusing function. The treatment principle that we don't really have or need in cold attack is that harmonization, because there's no sweating. There's no loss of yin qi. There's no loss of nutritive qi through the sweat. There's no imbalance of yin qi that's causing that slight sweating. So in fact, there's no sweating at all, right? So now that this brings us to the point prescription. So with the point prescription, we have wind attack on the left and cold attack on the right. And we have overlap between the 2 point prescriptions. The only addition between the 2 is really the stomach 36 in wind attack. Although, just as an FYI, clinically, I wouldn't get caught up on that, right? Because it's not a big difference in this pattern. If you add stomach 36, clinically, it's not going to harm your patient. In cold attack, you see on the right, we have moxa in cold attack because of the effect this modality has in warming, right? It warms the patient because of the cold attack. But everything else, there's an overlap, right? Because of the wind cold. You got UB12, you got lung 7, Li4, GB20, Sanjiao 5, Du 16. The only addition here is the stomach 36 and the moxa in cold attack. So let's start with wind attack. So let's go over the acupuncture points which overlap. So the point prescription calls for UB12, lung 7, Du 16, Li4, stomach 36, UB12, and Sanjiao 5 and gallbladder 20. And I put those in a certain sequence for a reason. So first one is UB12. It's UB12, which is also known as Feng Men, which means wind gate or wind door. Where's this point? It's the first line of the urinary bladder. It's 1.5 sun from the center of the spinous process, right? And it's next to spinous process T2. So wind gate, urinary bladder 12, 1.5 sun lateral to T2 spinous process. Its name basically tells you what it does. It's wind gate, right? It's a gate that's right at the front. It's right at the get-go. So when wind attacks the front, where does that wind go to first? Most commonly, wind first attacks the exterior. So what's the most exterior portion? We're talking 6 stages here, so we're going to talk about the Taiyang stage. Taiyang stage, what's in Taiyang? UB, urinary bladder, right? So urinary bladder is Taiyang. Urinary bladder is located as a channel in that neck area where wind likes to attack. So we can use UB12. You have the expel wind and release the exterior, strengthen the defensive qi, firm the exterior. You have that function to disseminate and descend lung qi and benefit the nose. So key acupuncture points for wind that we should remember is UB12, GB20, and DO16. UB12 is the wind gate, GB20 is wind pool, and DO16 is wind mansion. They all treat wind. UB12 out of the three is the most exterior one. It expels wind out of that exterior, releases the exterior, right? Because the wind, what's in the exterior? What's in the Toli? The wind is invading in there. What's in the Toli? It's obstructing the defensive qi. So UB12, it's like your B12 shot, right? It strengthens your Wei qi, which is your defensive qi. So that's why you have action number 2, which is strengthen the defensive qi and firms the exterior. And number 3, it disseminates and descends lung qi. So remember one of the functions of the lung, right? Go to my lung 7 YouTube video where I talk about this. The lung descends and disperses qi and body fluids. And what happens when wind gets into the exterior? It disrupts the flow of qi, and that's going to mess up that descending and dispersing function of the lung. And that's because the lung controls the space between the skin and the muscles. That's where defensive qi is. So the exterior pathogenic factor disrupts that space that the lung controls. The lung in turn gets messed up. Your patient then will have a cold, they'll have cold symptoms, runny nose, coughing, etc. And then number 4 benefits the nose. This is why UB12 has that action of benefiting the nose, right? There's that connection to the Toli, the space between the skin and the muscles. And that's why cupping is mentioned here, right? Cupping or gua sha can be really effective in releasing that pathogenic factor from the exterior portion. And this is why this prescription mentions cupping. I'm not going to talk about lung 7 right now because I'd rather you refer back to my lung 7 video, which I'll link in the top right and also in the video description. So next we have UB12 and large intestine 4, which is a point duo that releases the exterior wind. We also have UB12 and stomach 36, which is also a point duo. And this one is more prophylactic. This is like a prophylactic duo, right? So it's applied prophylactically, meant to prevent. So UB12, stomach 36, more meant to prevent. UB12, Li4, great for exterior wind. And then we have Sanjiao 5 and gallbladder 20. So Sanjiao 5 is the luo point, right? It goes to the chest, goes to the pericardium. It's also the master point of the Yang Wei Mai. What's the Yang Wei Mai? The Yang Wei Mai is the yang linking vessel. It links the yang channels. It also links the governing vessel, aka the Du channel. So the yang is the exterior, right? So we see the connection there. And it has an action to expel wind and release the exterior. And it's good at that because of the connection to the exterior and also to the yang channels. And then lastly, we have gallbladder 20. So for this, remember we talked about those 3 points, right? And we can do some imagery here. We can do some loci memorization just as practice. See, this is where you use locations to try and memorize things. And this is really helpful in acupuncture just because of all the different acupuncture points and the numbers. It can be hard to memorize. So using loci memorization techniques can be really helpful. So remember those 3, right? We talked about UB12, GB20, and DO16. So how we can remember these 3 is imagine you are walking into the estate of the richest person in the world. You pull up to their estate, right? They don't have a house, they have an estate. And you're at their front gate. You're looking at this massive front gate. And in gold lettering in the front, you see UB12 right on the front gate, right on the front wind gate. The gates open up for you and you see this humongous pool. And there's porcelain tiles and it's all colored and it's spelling out GB20, which is wind pool. And that pool leads you up to this huge, huge mansion. And this mansion is owned by Dr. Du. And he owns 16 full acres of this mansion. Dr. Du owns 16 acres of this mansion. That's an example of like loci memorization. So that's UB12 wind gate, GB20 win pool, do 16 win mansion, and so bada bing, bada boom, that's all 3. And that actually brings us to the end of this video. And next time we'll take another 2 patterns and we'll break them down. So I'm Dr. Richard Lai. I hope you found this video helpful. Hit that like button to show me you got something out of this video. While you're at it, click subscribe so you don't miss any study videos that come out. There's also a share button there, and if you're feeling up for it, share this video with someone that you feel would really benefit from it. So until next time, everyone, happy Thanksgiving. I hope you all stay safe, make good infection control decisions. God bless, and happy studying.